Hi, my name is Angel Langsford, or Angel Walsh now, since I was married 4 months ago from this guy, and once he said I do, I now get to practice on him, and he loves it. So, first of all, I'm going to wash my hands, because I don't have a sink in here. I'm going to use this. Hello, Mr. Walsh.
Hi there.
Can you tell me what brought you here today?
Just feeling a little off.
Oh. Is it because you said I do, and now you must do everything I say? So, just by having a conversation with him, I noticed that he is alert and oriented ×3. So, Mr. Walsh, I'm going to do a head-to-toe assessment on you. I'm going to start with your cranial nerves and work my way down.
Okay.
So first off, I'm going to do your cranial nerve 3, 4, and 6. I'm going to check your pupils, and then I'm going to get you to do all kinds of eye movements.
Okay.
Do you want to sit on the edge of the bed?
Absolutely.
Okay, my handy dandy thing has the pupil sizes on it. Got this as a gift for my work. Okay, so if you can take a look at me for a second. Both pupils are equal and reactive to light and round. And he is about a 3 positive. Now I'm going to check your ocular fundus. Looks good. I have a broken leg and I'm in a brace right now, so this is kind of hard. Can you put your head down towards me a little bit more? There we go. Okay, looks good. So now I'm going to make you move your eyes a whole bunch of funky directions, just so we get an idea. Up, down, across. I'm going to make you go diagonal here. And everything is perfect. So now I'm going to do the cranial nerve 5, the trigeminal nerve. I'm going to palpate the jaw. Feels good. Now I want you to squeeze your jaw, and I'm going to try and push down for any resistance. So it's normal not to be able to open up the jaw, so that's good that that's happening. And I'm going to check your sensory, so if you can close your eyes, and when you feel something, just say now to me.
No. 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 No.
Good job. Okay, now I'm going to make you do a whole bunch of funny faces for me.
Okay.
You can smile. Good. Frown.
I don't know how to frown. I'm a pretty happy guy. I don't frown.
Okay.
Is that a frown?
It looks perfect. Close eyes tightly. You're going to try and open them. Good. So that's just checking on the motor. And lift eyebrows. Okay, show your teeth. Blow up your cheeks. So what I was looking for there is just to make sure that his cheeks were even when he blew them up, and there was no cranial nerve damage there. Okay, I'm going to check out your muscles, which are very nice, by the way. I guess that's not appropriate, but he's my husband, so okay. So I want you to go against resistance. Good. Other side. Good. Okay, now I'm going to check your gait and balance if you want to stand up for me. Okay, on one foot. Tree pose. Other foot. Other side. Good job. I just want you to walk to the end of the room there. So with an elderly patient or a patient that doesn't have much coordination, you want to stand behind them just to make sure that they don't fall down on you. Okay, good. Sit down. Okay, now I want you to do your rapid alternating movements. So that's this here.
We didn't do that this morning.
No, we didn't do that this morning. Okay, so yeah, and then this way. Faster, 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 faster. Good job. So that's just making sure that all the information is getting down to where it has to go. Okay, so I'm going to do the sharp and dull test on you right now.
Okay.
Just put out your arm, close your eyes.
Sharp. Dull. Sharp. Dull. Dull. Sharp.
Good job. Okay, now I'm going to test your foot for vibrations. So having three kids and a dog and a broken leg, my tuning fork went missing. So we're going to improvise and use this for now. So I'm just going to test your toe and make sure that you can feel everything going down. Feel that?
I do.
Yeah. Just say yes. Or no.
Oh, I do.
Okay.
Yep.
Okay, good. Okay, now I'm going to move around your big toe. If you can tell me if I'm moving up or back or...
Eyes closed?
Yep.
Back. Or down. Back. Up. Up. Down.
Okay, other foot.
Up. Up. Down. Down.
Good job. So stereognosis, I'm going to put something in your hand. Close your eyes. And you're going to tell me what it is.
An elastic.
Good job. And then this is the 2-point discrimination. So I'm going to put 2 points on your hands and you're going to tell me if you feel 1 or 2. So with the nerves, it goes into one section and it covers a whole section. So sometimes when you're putting 2 pokes into one spot, the patient is only going to feel 1 poke as opposed to 2. You'll see like a lot of older people that have big scars on their arm from when they were injected with their vaccinations when they were younger, because in the olden days, instead of breaking it up throughout the years of their life, they used to give all 7 injections all at one site. So they have like the big scarring because a lot of them got infected and it wasn't a good thing. But it's because they only felt the 1 needle going in as opposed to feeling the 7. Sorry. Okay, ready?
Mm-hmm. 2. 2. 1. 2. 1.
Good job. So that's exactly what he should have been feeling. So I'm going to check your reflexes now. Okay, that. Okay, robot arms, let's relax. Weird. Robot arms. I'm just going to hold on to your thumb and do your forearm here. Good. Okay, now check out your knee.
Hands up.
Yeah, please. So I'm going to use the flat end of this because there is a nerve there and I don't want to create any swelling or damage. So I don't want you looking around the next week. So I'm going to use the flat end as opposed to the sharp end. Good job. Good job. Okay, now I'm just going to cross your legs and check your Achilles. Good. Other side. You doing okay with all this movement?
I am.
Good job. Okay, so now if you can lie down for me, I'm gonna check your superficial. So this morning when I was doing this, you didn't have much of abdominal superficial. So we're gonna test them again. Get that fluff out of your belly button. Here you go. So what I'm looking for right now is the contracting. I got a little bit there. Good. And then I'm looking for a Babinski sign to see if there's any damage. So what I'm looking for is either his toes to go in or no reaction. If he does have damage, his feet will fan out. So no Babinski sign. No sign at all. I don't know if that's a good thing. Should I be getting life insurance? Just kidding. Good. Now I'm going to test the heart and neck vessels. I'm going to check that it's carotid. In a hospital setting too, I won't be on my knees. I'll obviously raise the bed up to me, but we can't do this while we're here, so this is going to have to do. So I'm going to check out this carotid. I'm not going to palpate them both at the same time because I will suffocate them. Good. And I also want to make sure that there isn't a lot of venous pressure building up because that would suggest that he was getting cardiac overload. Good. So I'm going to check out his chest, look for any mumps and bumps, for any bruising, look for any pulsations that are not supposed to be there. Can you exhale for me? Take a deep breath and exhale. And I'm just looking exactly where his heart is. And for any pulsations, okay, good. And I'm going to feel for any heave or lift or thrill, any palpable vibrations, and I can't feel anything. So now I'm going to auscultate. I'm going to use the diaphragm first. Which is, his pulse rate is 80, which is perfect, so that's good. I'm not too nervous. So I have a little cheat sheet here. Okay, so there's no adventitious sounds. His S1 and S2 were good. There's no extra heart sounds, no murmur. So now I'm going to listen again with the belt of my stethoscope. Get you to lie on your left side for me. So I'm just going to listen to the bass here. See if anything changed with movement. It still sounds really good. Okay, good. Now I'm just going to check out your chest and your lungs and all that stuff. So again, I'm inspecting, making sure that everything looks okay, no lumps, no bumps. See what his respiratory is like. Just going to give a quick listen to the front here before I get him to sit up. Rest are good. Earrings under the bed. Earrings under the bed. Earrings under the bed. Yeah. Okay. Okay, if you can sit up for me. Okay. So listen to the bell. I'm going to listen to you from the back too. Sorry, I'm still moving. Good job. And I want to make sure that I don't go over the scapula because I won't be able to hear much over that. His lungs sound clear. There's no tightening. There's no abnormal sounds. He's at 18 breaths per minute. going to palpate. Say 99 for me.
99.
Say it again.
99.
Again.
99.
Again.
99.
Just making sure that all the vibrations
99.
are right. Good.
99.
Okay. I wouldn't be doing this in hospital setting, but just improvising here. Take a deep breath. So what I'm looking for there is that my hands are going up evenly at the same time on both sides. So that is good. Okay, can you lie back down for me? Should actually percuss you when you're still sitting up. Sorry, can I get you to sit up again?
Yeah,
sorry.
That's good.
Percuss his back. Make sure that I'm not feeling anything abnormal. Okay, that's good. Okay, so I should have actually percussed before I auscultated, but that's okay because I still got it done. Okay, lie down and check your abdomen out now. So what I'm looking at here, I'm just taking a quick look and making sure that there's no pulsations coming out of his abdomen. And I want to do the inspection and listen before I start palpating, because if I palpate first, then I'm going to create a lot of bowel sounds and create a different assessment than I would have if I was just doing all the other things first. So I'm getting my light and I'm looking for any kind of lumps or bumps. This is a good way to find an earring at the bottom of a bed in the middle of the night shift. So there's nothing there, that's good. Want to check out his umbilicus, make sure that it looks good, not infected, not red, it's good. His skin is smooth. There's no pulsation or movement. His hair distribution is good. His demeanor is relaxed. He's not anxious about anything. So what I'm going to start now is my auscultation. So I'm going to start in the right lower quadrant and listen to bowel sounds. That's good. Bowel sounds are definitely present. Now I'm going to listen for any extra sounds, any vascular sounds. So I'm going to check his femoral artery down here, make sure there's nothing there. And this is his iliac artery around here. His renal artery, aorta, and the same thing on the other side just to make sure. Good. So all I'm hearing is bowel sounds. And then I'm going to do percussion in all 4 quadrants. So it's normal to feel the air come up because of the way that he's sitting in his bowels, he's going to have the air come up. So I am determining the tympanic sounds versus the dullness. I'm going to percuss for the liver. And my pen. There. Sorry, I'm going to make marks on you.
That's okay.
it's good. It's about 6.5. It should be between 6 and 12. So we're good there. Let me see if I can palpate it at all. Take a deep breath for me. Good job. And I'm just gonna palpate the rest here. See if I can feel any bumps or masses. Still okay?
Mm-hmm.
And I'm going to check his spleen at the side here. Smell axilla down. Or a spleen, sorry, not a spine. So it's normal not to feel his spleen, but if it is enlarged, sometimes you'll be able to feel it. And then you can also try and feel for their kidneys too. Just put your hand on the back. Okay, that's good. Almost done, not too much longer. Okay, so now I want to check his skin, hair, and nails. Everything's good, even. No clubbing. Cap refill is under 3 seconds for sure. Good. I want to check the skin turgor to make sure he's not dehydrated. So skin, I can barely even pinch anything, but with the elderly, you'll pinch a lot and it'll stay there for a while. That's how you know that they're dehydrated. His hair is evenly distributed. His color is good. Gonna check your lymph nodes, check for any bumps. Two out of 3 of our kids are sick right now, so it's good to check for these things. Okay, I'm checking for his neck. Can you look side to side for me? There you go, other side. Good job. Now against resistance. Good job. Other side. Good. So I'm checking for any unusual masses, any glutes, goiter. It's all good. So his eyes we did earlier in neuro. His pupils were equal, round, reacted to light, accommodating. There was no discoloration, no jaundice. If you can sit up for me, I'm just going to check your ears. So I'm looking inside of his ears. I'm checking for any lots of earwax or exudate that's not supposed to be there. I'm looking for the eardrum. It should be shiny and gray. So with an adult, I want to pull up and back, and with kids, I pull down. So I want to put it facing upwards, so with my hand there, that way if anything happens and he happens to jerk, he's still protected. And that was easy to find, looks good. And check the other side. Also looks good. Check your nose. Sorry, I didn't mean to shine the light in your eyes there. Good. Open up your mouth. Say ah. Okay, good. His tonsils aren't sticking out or anything, so we are good. Okay, now I'm just going to check your pulses. Make sure they're even on both sides. Feels right. Okay, and pick pulses. are my favorite to check because I'm an ortho girl. Good. And good. Okay. You are good. I don't need life insurance.
Let's get some anyway.
Okay.